Hey, Lindsay. Did you have trouble getting into the meeting?
Yeah, no, it was fine.
Okay. I'm surprised nobody's here yet. So I was just
Oh no.
worried like I did something.
No, I clicked the link in the email you just sent out now. The
Okay.
link in the flyer from a week or two ago didn't seem to work, but I feel like most people will join from this link.
Okay. Well, hopefully people saw that email then. Oh, here we go. All right.
Hi everyone. I think maybe we'll wait like another minute to see if any other people join. But thanks all for coming. And I just wanted to say how exciting it is that Joe Biden has been president for the last 2 minutes. Yeah, it's a nice change.
Hey, everybody.
I agree.
Got done watching the inauguration next door with Max, and
It's exciting.
yes, big day.
Yeah. So I appreciate everyone who's here at the same time that the inauguration is on, and there's a lot of other things going on in this country. But I think kind of what better time to talk about some of the issues raised by this paper. Shall we get started? If anyone wants to kind of filter in late, they can just do that.
Does Abby, Abby, do you want, yeah, I think Abby has a couple of announcements and then we'll get started. Yep.
Yes. Welcome back everybody to the new semester. In December, we sent out a poll just checking in with our students and staff to see what ways we could be helpful or what other ways might be helpful to connect with each other. And from the results of that, I'm sorry if you can hear my toddler screaming. He's like upstairs singing, but so please just ignore that. So we are going to be doing 2 new events this semester. The first one is going to be a monthly dissertation writing session for doctoral students. So this will be a time when you can just come together, I guess, on Zoom and be together and write and bounce ideas off each other. So we'll do that. The first one will be on January 27th, and this will be at 12 p.m. on Wednesdays on the off weeks that we don't have seminars. And then the second event that we'll be doing is in office hours, and we'll have faculty there who will run kind of informal professional development activities. And the first one of that will be on February 10th. So I will send out Zoom links and further information about this, but just keep your eyes open for that. And I think with that, I will turn it over to Lindsay.
Thanks, Abby. It's really exciting that we've got these new social and professional development activities this semester. I'm looking forward to it. So again, welcome everybody. Thank you so much for coming, especially today. And I'm really excited about this paper. I think this journal club can be very informal, very casual. How I'm going to structure it is I will do a brief introduction to the paper, and I'll just kind of give an overview of the paper, why it was done, what they focused on. It's not the kind of typical empirical epidemiology paper with, you know, a background, methods, results discussion. It's a commentary paper. They also did do some data analysis in it as an example to help motivate their argument. So the structure that our discussion will take won't be quite the same as kind of breaking down the different traditional parts of the paper. I have some discussion questions kind of focused around really important big issues in our field that the authors raise. And then I also, of course, want to open up the floor for, you know, reactions and comments and questions that people also want to raise. So we'll see where the discussion goes. So basically, I'm going to give an overview, and then you can also just feel free to interrupt me and talk from that point on. We'll see if we even get to the specific questions I had based on what everybody else kind of raises and thinks. So let me just do a really quick kind of rundown of the paper just to make sure we're all on the same page. So this paper is called Racial Capitalism Within Public Health, How Occupational Settings Drive COVID-19 Disparities. It was published last summer in American Journal of Epidemiology, and it's by Elizabeth McClure, Pavita Vasudevan, Zinzi Bailey, Snehal Patel, and Whitney Robinson. And I chose this paper basically because I just really wanted to read it. And I kept not having time, and I thought this was a perfect opportunity to force myself to read this paper. And I think it's actually a really important kind of big picture paper in our field. And that is obviously, I'm sure, subject material that is very relevant to us in CSEF and relevant to what is going on with COVID-19 disparities. But it's not only about COVID-19. I think this is kind of about the dominant paradigms in epidemiology, what we study when we do epidemiology, and particularly in social epidemiology, and how we can do better. So that's kind of where I'm hoping this discussion will go, thinking more broadly about the field. So basically, McClure and colleagues wrote this commentary really focused on, you know, the role of occupational settings in COVID-19 disparities, and how, well, really there's kind of two main points. And the two main points that these authors make is, one, we can use these theories or frameworks of racial capitalism and inverse hazard theory to understand occupational structural drivers of COVID-19 disparities, as opposed to these kind of traditional individual risk factors that we so often study in epidemiology, such as, you know, underlying chronic conditions or health behaviors, for example. And then they build on that to make the point that epidemiology has really been complicit or co-opted into this form of racial capitalism by you know, corporations, industries, which have financial interests in the example that they give, which have, you know, their main goal is to make profits, and often this comes at the expense of workers in a very racially stratified way. The example that they give here in their data simulation was with respect to race corrections in algorithms that determine eligibility for workers' compensation for lung impairment and hearing impairment, and we can talk about that. And how epidemiology has been co-opted to serve the purposes of racial capitalism, and how we must do better. And that's something that's kind of the bigger picture that we can talk about here. And so what the authors mean when they talk about racial capitalism, and this is on, I believe, page 2 of the paper, and I'm going to read out the definition here so we're all on the same page. And racial capitalism is a term that was coined by Cedric Robinson, and it refers to the centrality of race in structuring social and labor hierarchies in capitalist economies, such as here in the United States. And this system ensures, and I quote, a vulnerable supply of low-wage workers through dual wage systems, racially exclusive labor unions, racialized divisions of labor, sharecropping, and related practice. So ultimately, under the theory of racial capitalism, Black and Latinx and other minority individuals of color end up being overrepresented in low-paying jobs. And during the COVID-19 pandemic, these are the jobs that have typically been deemed essential, where people experience greater exposure to COVID-19 infection. And so it is really these structural drivers that are driving disparities through occupational sorting and exposure, again, as opposed to individual behaviors. They also draw on the, I believe it's Krieger's theory, the inverse hazard law, which states that hazards accumulate inversely with power and resources in United States workplaces. And so essentially what this means here is even under equal or similar levels of exposure, individuals in more privileged positions and with more power will be better able to protect themselves from risk. And here, for example, this would be like having access to PPE with respect to COVID-19, as opposed to people who occupy positions of less power and less privilege. And so the authors propose that we really need to apply these two theories in order to understand what has been one key contributor in driving COVID-19 disparities in the United States, and how this kind of runs counter to how we actually collect data and analyze and interpret data in our epidemiologic studies, which tend to be very individual. And then we also have this example, as I said, that's focused on workers' compensation claims. So that was basically the paper. I did prepare some discussion questions in case we kind of need some prodding along, but I actually just kind of want to step back and open the floor. And I wanted to ask people, like, what were their reactions to this paper? What did they think? Were there any areas that were confusing or unclear that needed clarification? What did people think about this paper?
I don't want to start because I have very strong reactions. But if anybody else wants, if nobody else has anything to say, then I'll jump in.
I know it's a really intense paper to choose for journal club. So I definitely understand having strong reactions.
I think you should start, Zoe.
Well, thanks, Lindsay, for choosing this paper, because it was one that I had read, I think it was about 2 months ago. A former CSEF member, Kate Duchovny, had recommended it to me, and I read it, and I took notes and was extremely inspired. It was the kind of paper that I talked about at the dinner table, to my husband. And then somehow the next day I just got really angry, and I was like, but what about the occupational epidemiologists? They've been doing a lot of this. And there was something about, so this idea that, so everything, I agree with everything that she's saying. I think just there was a way that she framed the failure of epidemiology that sort of bugged me, and I think it could have been a little bit more specific if it had factored in. So occupational epidemiologists, their job is to focus on workplace exposures, right, and identify them to keep workers safe, and they have for decades been looking at occupation as as a, as a health factor, as a health risk. So I think in some ways she could have actually, but the problem is that occupational epidemiologists wear their hats as occupational epidemiologists and they're not social epidemiologists. So I think it's more that there needs to be more conversation between those two fields, and that would elicit a greater response. Not that epidemiologists, like general epidemiologists, have to reinvent everything, because their methods already of looking at occupation and identifying high-risk occupations and vulnerable individuals based on the type of work that they do, and their socio-demographics. But I think that there really needs to be more conversation between these two fields in order to do a better job at identifying areas where we can make improvements, I would say. But that's like, I guess, more general comment.
No, I think that's spot on, Zoe. Those are really, really great points. I definitely have things to say, but I also don't want to talk over anyone else if they want to build on what Zoe just said.
Thank you, Zoe, and thank you, Lindsay. I enjoyed the article as well. It is kind of a throwback for me, coming from a very much social sciences background. It was kind of up my alley. I was very comfortable reading this article. But one thing that I really enjoyed the fact that they tried to provide empirical simulation data, and it was a very, very smart way of showing the discrepancy and kind of leading us to the potential implications of actually very real structural racism as it enacted in like economic terms. At the same time, I think I felt the second part of the article where they're talking about COVID inequalities was mostly supported through quoting like articles that were published in some sort of news agencies, such as like BuzzFeed and NBC News and things like that, which to me kind of, I was like, I'm going along with, you're already convinced that this is an important role. I don't necessarily want to read the articles that we all know have to be taken with a big grain of salt to trust the implications there. So it felt a little disappointing to use to kind of pad the argument that they're making by the references that they're providing. So that's where I was kind of standing. But I really like the example with the occupational, the hearing loss and lung capacity. I think that was brilliantly done.
Can I just make a comment to Victoria? One thing I noticed, one of the problems with identifying workplaces is, like she mentioned, like we don't have any occupational data related to COVID deaths. So like when somebody or cases, so when somebody, the Department of Health doesn't ask like across the board, what is your occupation or what is your industry? So it's actually been really hard to, I think, in research to actually generate peer-reviewed articles that are able to demonstrate the points that she's making. Because it's not required right now. It's just it's not required for occupations or employers to report cases. It's recommended. There's guidance, but there's no penalty for not doing it. So that might be just one of the reasons why she's relying on newspaper articles and individual stories to support that part of the text.
Well, I understand that, and it's a very valid comment. To that comment, I would say that then the writing should be framed as such, as opposed to saying that it's like absolute truth that is a tweet. It's very strong, like somebody's angry writing this stuff. And I understand the anger, and a lot of these points, it's like, yeah, that's what I was thinking. Great, thank you. And then I'm like, let me see what she's quoting, because like I wanted, like, yes, that's what I was thinking, but I didn't have any evidence to back it up. And then she's like just saying BuzzFeed. So
yeah,
again, I think careful phrasing is very important, and I think it goes back to our epi studies and what we write and how we make our claims, making a little more careful kind of inferences.
I just wanted to come back to your point, Zoe, about, what about the occupational epidemiologist? I think that's spot on. And I wish, I'm not familiar with all of the authors on this article, but it sounds like, and maybe one of them is an occupational epidemiologist. So maybe I'm going to take this back, but it sounds like they should have collaborated or brought in an occupational epidemiologist. Maybe they did. Maybe I'm wrong here. But I think the point you made is not like, too general or anything like that. I think this kind of gets at the heart of what I think could be one of the most valuable contributions of this article, is kind of like the broader implications for the field, and how much do we suffer by having different subdisciplines within epidemiology siloed. And there was no social epidemiology, there was no occupational epidemiology when the field really began and was born out of medicine, right? And we've kind of brought in these subfields, especially through collaboration and integration and learning from other disciplines. And I think occupational epidemiology is like quite siloed compared to other subdisciplines. And it's like occupational epidemiology really is social epidemiology, because work is such a fundamental, and the working conditions are such a fundamental social determinant of health. So I think, like, yes, we definitely need more collaboration in this area. And I know social epidemiologists are interested in various policies, and there are social epidemiologists who study work. But it's, I'm sure, at a much more surface level than what many real occupational epidemiologists do. And when I think about it, I'm curious to see what kind of work occupational epidemiologists are doing right now with respect to COVID-19, and policies that shape COVID-19 risk. Yeah, I'm curious. I'm going to go look up some occupational journals and see like if there's anything being published that's relevant.
I mean, I think that to your, I guess I would challenge a little bit, like that, at least that, where does occupation, where did occupation come into the field, because I think that there are, certainly like sociologists, as whether it's Karasek's kind of job strain, job control, I mean, there had been a large group of people doing work, potentially from this stratification, and resource allocation framework in sociology, but it may well be that, and I think to Victoria's point about like the importance of bringing in data, it's like the types, so much of sociology or these other fields relies on self-report data, or maybe like if, maybe administrative records, but even then they don't really, that's not very uncommon in soc. And perhaps this is where the problem with the biomedical comes in, which is, there's just like a lack of trust of self-report data, or there are obviously a lot of concerns with self-report data, but there become this sort of set of, goalposts that potentially keep moving, in order to kind of just, demonstrate the validity of whatever claim there that potentially like more social science or people that were focused on occupation, or workers' rights, or unions, like what are unions arguing for, how are that is that part of, I mean, I think there's a whole, so to me it's sort of, it almost like reflects like epidemiology. We have or there can be a way to do epidemiology that's very narrow, and like this is what that scope is, and like it requires these kind of bars to be met, and anything outside of that is less than, it's not just different, it's actually like not appropriate data. And it even comes down to our referring to randomized controlled trials as gold standards for any kind of evidentiary claim, and everything else is less than, right? And like, yes, that's true, right? But just, it also by definition is now making things outside of the realm of knowable like real knowledge, right? Like you can't, because you cannot randomize people to occupation, right? We can't, so like therefore we can never know, really know. And I understand, I guess I understand that argument as to why it's so important that if we could randomize and tell through an experiment that we should. I mean, I understand, right? But I think I mean, I don't even know what proportion, I don't know, maybe Lewis does, like if he's, what proportion of like medical interventions were like not studied in a randomized control trial. Like, I mean, like they were studied in other ways, right? But like, I mean, just a couple of years ago, there was a big randomized control trial in the Lancet that showed that basically putting in a stent had no impact on cardiac outcomes compared to like intensive, and like nobody believed it. Like nobody wanted to believe it because of course everybody, they did the sham surgery and it was like, how could this possibly be true? But it turned out it had actually never been tested in a randomized control trial. And we've apparently been exposing people to surgery that we didn't need to expose them to, that we could have managed in a less invasive way. And so in that sense, obviously that's an example of why we did need a randomized control trial. But I guess it's like, it's a standard that we live with. We manage our life without that kind of evidence in so many other ways. And yet when it comes to epidemiology, we like seem to demand that kind of evidence in almost like an obsessive way. I don't know. Lewis, do you agree or no?
I think the obsession is a good thing.
Yeah.
I would say that most of medical interventions have not been tested in randomized control trials. You guys, I'm sure, know that devices are approved without RCTs and all. Basically, if there's a cousin device that had been approved previously, they just get approved and approved year in and decade out. So yeah, there are a lot of these things, like you cited a really important one, the people who have stable angina who get stented. I mean, there's no evidence that it reduces mortality, improves outcomes. So, I mean, I think that demanding good evidence before we make a conclusion is really important.
Mm. But how does that, in a world where we've had a history of like situations where the status quo exists without said threshold being met, you know what I mean? Like it's almost like now it's like there's a, I don't know. What I'm trying to say. It's like, how do you, because it's almost like we need to actually have the failed trial to roll back something now, even though the status quo is not based on evidence. You know what I mean? And like, that's actually like a kind of a perverse logic because we didn't use this randomized control trial to get to the status quo. So why would we require better evidence than what got us here to get us back from here? Like, could we take a different approach of a preponderance of the evidence or different lines of evidence or a value, like in this case, like racial justice? Like, could that be something that we pursue even without that kind of evidence?
Yeah, I mean, I think that's a good argument from the medical side. We spend overwhelmingly more money than any other country on healthcare, and everybody knows the World Health Organization ranks us between Costa Rica and Cuba in our efficiency. So I think a lot of it has to do with the fact that we spend money needlessly on these procedures and drugs, and patients have poor outcomes. And, those are really tragic. As a neurologist, I see a lot of the outcomes that are just terrible. And, you go back to the original procedure and there's no evidence why the person had it in the first place. When I was listening to Lindsay's argument, I mean, so my New Year's resolution has been to try to figure out what the other 70 million people in the country who disagree with me would say about things. And I think that most of the people in social epidemiology feel the same way, feel very strongly about these issues. But it seems that the only way we're going to move forward is if we argue with evidence, that if we provide, objective evidence to put things forward. So most of us believe exactly what this article is trying to say, that a lot of the disparities in COVID susceptibility and outcomes has to do with occupation and racial capitalism, but I think we do have to prove it before we can convince people.
What type of evidence would you want for an occupation? Like what are you talking about in terms of like randomizing and for our occupation? Like what type of evidence are you looking to gather? Because I feel like there's tons of evidence of like close proximity to other workers, like ways to identify a occupation that's of high risk of COVID transmission, for example. I'm just trying to follow the argument.
Yeah, I mean, I think that it would be unethical to and take too long to randomize people to answer that question. I think there should be other study designs that would evaluate. I mean, I agree that the article, I kind of lost some of the support of the article when the sources that were cited were media sources and others. I mean, I think the evidence that we're looking for will come out. I don't think it will be from RCTs, but there'll be better studies.
I think one of the recommendations the authors make at the end of the article is that epidemiologists who are studying COVID-19 should be routinely collecting data and high quality data on things like occupation and race and ethnicity so that we actually can look at rates of infection and even if we want to look at hospitalizations and mortality by occupational industry and say by race within occupational industry, I guess would be the best kind of observational evidence. But even then, some of these things that they talk about they're like a little squishy and hard to measure and kind of relate to some of the self-reported things that Bree was talking about, like access, like how do we get data on access to masks and PPE within an occupational environments? It can be self-reported, which can be readily kind of picked apart and criticized. There's no incentive for employers to report information about whether or not and they're making PPE available to their workers, whether they're implementing other forms of occupational protections like social distancing and things like that. So I think it will be hard to get good quality data that are representative as well. I think it's hard.
I mean, a lot of that I think is due to a failure by the Occupational Safety and Health Administration not to issue an emergency temporary standard to make requirements for what employers have to do. Because then they would have to provide PPE, and if they didn't, they would be fined, for example. And like that, actually, for employers, for some employers, they need that penalty in order to actually do what they're supposed to do. Not all, but a lot. So I think so now it's like, yes, you could survey workers, but it shouldn't even be a question, right? There should be like there should be standards on what the employers actually have to provide. And unfortunately, there is none, and a lot of them don't have PPE and are forced to work next to each other and are told, that they can't take sick leave. I mean, terrible things that you hear about in newspaper articles because we don't have any other way of collecting that information.
Yeah, so really then what you're saying is the onus should be on the employers and the workplaces to routinely report these kind of data as opposed to the epidemiologists to go out and try and collect them in very imperfect ways.
I think there should be rules to protect workers from these types of hazards the same way that there are rules to protect workers from lead exposure and fumes and dust. It's an occupational exposure that, I think there should be rules to enforce it. And then you have agencies that go and inspect and make sure that those are being met.
I agree.
I mean, to that point, I have seen, like they'll, on our, whatever the daily briefing from the governor, at least in our state, they are reporting when businesses are fined, for violations, and they report, at least the public report tells you where it came from, actually what alerted them. And almost all of the ones that I've read have been an employee who has called the state saying like, there's, either something is not being met here. And I mean, it's an interesting, on the one hand, it's interesting that, especially if it's a small employer, the employer could almost, because on the one hand, you want to like protect retaliation, right? Like if somebody's reporting their employer, they're getting this fine. But then on the other hand, it is pretty empowering, I would imagine, for other people to see, if they did see like, oh, like that place got called out, and you can call them up, and like they'll come, and like whatever I mean, a lot of them are restaurants or other sorts of things that are being open without anyway. So I wonder if other states have been doing that kind of reporting. So maybe that would, because I do think the issue of the source of the information and the vetting of the information is quite important, because I don't know. I'm also been trying, I don't know why, like at least on my computer, like AJE is not opening, like the main page of the journal, but I'm actually really curious as to whether the disclaimer that starts this article is published on every commentary. Does anybody know? Because for some reason,
I was wondering the same thing, Bri.
Yeah.
It's like been down the whole time we've been sitting here. I've been trying to look.
I'm gonna look now, Bri, while we're talking, but I noticed it, and I don't think I've seen it before. And yeah, the AJE website is actually not working for me either.
They know.
No, we're on to them.
They know we're looking. Okay, well, that's good. It's not just my computer, at least, but I'm curious. I'd actually kind of want to call Whitney and ask her because oftentimes when it's a commentator, the commentary, at least when I haven't published commentary in this journal, but in other journals, you're just dealing with the editor. It's not going out for review. Mm-hmm. Not peer review. I mean, it'll be handled internally. So I'm kind of curious as to it. I don't think it said who the editor was on this journal or on this article. Sometimes they'll say who the editor was.
Another interesting thing about this one is that it was an editor's choice. So it's funny to have that disclaimer and for it to be editor's choice. And actually, I'm getting that the AJE website is working for me when I go outside the UMich proxy. Okay. But I'm trying to find, I don't know if this was was it an invited commentary? It wasn't.
And it went from submission to exception within 6 days,
Yeah.
So I don't think this didn't go out.
Actually, I wrote an AJE commentary. I don't think it has the disclaimer. No, I just pulled up quickly just a couple of other commentaries, and they don't have the disclaimer. So it would be curious to find out why.
What is their threshold for when do they disavow the opinions? And does that mean all other opinions published in commentaries are the express opinion of the AJE staff? Yeah. It's a very strange thing.
Yeah, it sounds like they found it could be potentially controversial in some way.
But what does that even protect them from? So what is putting a disclaimer on there? It's almost like it's kind of, what's the purpose of that?
They don't have to stand by the fact that there's collusion.
That they've colluded with the authors? I don't understand. What do you mean?
In the abstract, she writes, they write.
That we have colluded.
Yeah.
Yeah.
There's one other thing so to answer your question, Bri, I think that so Michigan has its own MI OSHA, right? And in other states, some states do too. And then there's the federal OSHA. So I think state by state, there are differences. But a lot of this is also like the employer has to provide good information, right? And I know that there was one example of Amazon, because they've gotten so much press about, having all these workers, so many people working for them right now, because everyone's ordering everything online. So Amazon actually published the prevalence of COVID cases throughout, among like their, whatever it is, I don't know how many hundreds of thousands of workers they have. And it kind of, and they made this analysis where or it was like a table where they showed like in that county, if their rate of COVID positive individuals was greater than or less than what was within that county. And their review, this publishing was like very, very bold. They were like one of the first large, or probably the only large employer that I know of who's done this, but it also got totally slammed. And a lot of people said like they should have worked with epidemiologists because their data table was like, they didn't adjust for sex and age necessarily. I can't remember the specifics, but that's like kind of an example where I think that, you know, having this type of data, because like these corporations can, like it's up to them to publish it, and so they also need help in understanding how to in some ways. So that's like another point, I guess.
Well, I think it also points to the, the fact that like there's, in some cases there is real disagreement about, maybe not this specific case, but in some, like data doesn't answer all questions, or it doesn't answer all the questions that we actually want it to know. And there are different ways of looking at it, right? Like the US case fatality rate for COVID is much lower than other places, yet our case rate is much higher, and our overall mortality rate is much higher. So, I mean, people could point to these different pieces, and it's like, yes, you have to look at all of them. You have to understand them in context. And because as we produce different statistics, people, hold on to them. And then when they change, or when they get updated, or when they get corrected, that becomes evidence, to like Lewis's point, like that correction or that refinement or that update itself becomes evidence that the past was false. Why should I trust the now, right? And to my mind, there's a, in addition to like a, it's like I guess this kind of comes back to like why the focus on capitalism. And I put capitalism and public health into PubMed, and was kind of shocked that over 100,000 hits came up. A lot of those are actually talking about social capital, it turns out, not capitalism. But still, like because I'm writing a chapter right now on colonialism and diabetes, and looking at First Nations people around the world, and there's only like maybe a few hundred hits on colonialism and health, right, in PubMed. This is not a word that's kind of being used, but there's kind of a fundamental, I guess what the thing is, like, when do people learn about capitalism? When you live in America, right? Or any capitalist, we don't learn about it. We are it. Like we are living it every moment. Like we're all talking to each other on devices that were you know what I mean? Like, so I think there's, and it I guess points to the idea that like part of the reason why we don't talk about the economic system and the costs and benefits of this economic system, and what are all the alternate economic systems, or whatever, is that there is a group that is highly benefiting from the status quo, right? And those are so I think that sort of even being able, and maybe this is what this article is really trying to kind of say, is like, who benefits from the situation that we are in, who loses. That group loses in multiple different ways, and has been losing in multiple different ways, so I think sort of that is there's like kind of to Lewis, it's like to your point about like why do other people feel differently about things? I think part of it is like there's a whole like there's all these things we don't talk about, or we don't have opportunities to talk about or question, like why is it done this way, like why, and it's because it's the it's the air that we're breathing, literally, and if we can't agree that we're breathing the same air, then like that, I don't know. Sorry, I'm just rambling now.
No, I think that makes so much sense, Bree. And I don't know what the right word for it is, but it is one of these things that is unquestioned and assumed. That's so woven into the fabric of our society. And I think even things like structural racism were not questioned, and was part of, like like there are these natural groupings of people in society based on race, which I think only more recently we've come to question and talk about in like public discourse and in the media, and maybe, and I think capitalism, I think it's something that is pretty much like unquestionable in US society. And then one of the things as I was reading this paper made me think like, well, if many disparities in health that we're seeing are at least in part influenced through whether it is racial capitalism. We know capitalism is inherently class-based as well, and like gendered as well when we think about like labor force participation and things like that. If like capitalism as a whole is in part driving some of our health inequalities, why aren't we talking about it? And what can we what is there to do? And are there aspects of this that we can measure? And when thinking about what the authors say in this paper, is this something that is more of a kind of theoretical approach, something to think about contextually when we're designing our studies and where we think risk comes from and what are the relevant things to measure? So is it just kind of like a framing issue or a theoretical issue, or can we actually measure variables that might be more structural in nature and kind of influenced by the capitalist structure of society and workplaces, as opposed to kind of more individual level factors or alongside individual factors? What is the best way to deal with this, I guess, in our work, if this is something we really want to treat seriously? And I don't know an answer to that.
I mean, capitalism is always in our society has been seen as a way to achieve some sort of protection, right? You move out of the city to a place that is quote unquote safer. You have better access to, care in a number of different ways. And I mean, I think many of us kind of question whether that's the right system for a society, but that's also very different from talking about when aspects of society are systematically prohibited from kind of playing the capitalist game, right? I mean,
Yes.
those are, I think, two very distinct arguments. And, when people argue about whether capitalism is good or bad, that seems to be distinct from saying, in our society, not everybody can succeed in our capitalist world.
Mm-hmm. Mm-hmm. I think that's a good point, Louis. I mean, I guess she could. I mean, this article, I guess, could have been. It's interesting because it could have been called. There could have been like a box of like, what should epidemiologists do now? Some of that might be around the type of study, but as workers, and like we work for large employers, right? Like, is this about internal change, or is this about get on the picket line, or is this about what I mean? Is like there could have been an accompaniment piece there, like if not just talking the talk but walking the walk, if this is the piece here. So I don't know, I mean, it's an interesting it also sort of reflects the separation between what this journal does and who even reads this journal and who this journal matters to, and the lives of the people that are discussed in this article.
I don't really think that we have to look beyond our own employer, right?
Yeah.
We don't, we don't have an acceptable minimum wage for employees on campus. There are the same sort of racial categorization of jobs at the university. And most of the time when I attend faculty senate meetings or something, the discussion is about how to get the faculty, more money and other things. So we could start with our own employer.
Yeah. Yeah, I mean, it's curious as to how they, like, what is happening even with like the vaccine rollout. Like, did the university sort of, I mean, my neighbor works in groundskeeping at U of M and he still hasn't gotten his vaccine yet, even though he has to go to work every day. I haven't got mine either, right? But like, the point is like there are the essential jobs on campus, Obviously the state has certain guidance about different things, but like, I'm certain they were talking to people at U of M as to how we should implement this, since every state kind of got to do it their own way. You can't tell me that there weren't people in our own department that weren't on those calls about who should actually be first in line for this vaccine when Michigan Medicine is able to roll it out.
And that's, maybe we're getting a bit tangential here, but that's been a huge issue. I think there was even a New York Times article about, staff working and researchers specifically working for schools of medicine and academic medical centers getting the vaccine before many other essential workers, even when they work remotely. So yeah, like I think we are seeing this even with how COVID is dealt with.
And that's something that can be quantified, right?
Yeah. I mean, I think that would be interesting to kind of see, like, when 6 months from now, when we have the data, like which types of occupation got it first, and how did that relate to, or was that even related to their exposure risk, or obviously the university knows the cases that are reported to it, right? So it could have used data to prioritize. But then I think it's also like, this is also about a value, to my mind, is like, what is the value that, like, capitalism has a set of values, and and we don't necessarily call them that, right? But that's what they are. And is that it's that, I guess by definition, that also means it has a set of things that devalues, so it's interesting, you can kind of, it's not that you have to like throw out the system, but if you can at least name those values and devalues, then you can do things to adjust them, whether that's like, okay, well, we need to set a minimum standard, or we need to work with this set of priorities, or this is the status quo, this is the default of what will happen if we don't do X, Y, or Z. And so in this small space, we can do X, Y, or Z to I mean, I think that when people say like the way that COVID has played out was completely predictable, that's what they mean, is like, we knew it was going to happen this way, and yet nothing, and yet it still happened. And so this was a situation where, was this about a failure to communicate, or was this about a different set of, no, like, I hear what you're saying, but I value this, and therefore we're going to go with that set of values. It doesn't matter what the data are, I am also like totally aside, but like, I am curious as to how, as a non-social media person, I'm always like interested in how these social media stuff get in. Cause like maybe last year, JAMA published a paper that I believe, to my knowledge, was the first time the word influencer was used in a JAMA article about the Netflix show 13 Reasons Why, and looking at suicide contagion among adolescents. And I shared it with my undergraduates, and it was just, I was like, I feel like this is, I'm just trying to imagine the typical JAMA reader and like reading the words like influencer and number of tweets and whatever. And I'm just like, this is not our life. Like, this is a totally different life. So I'm actually just, it's always interesting to kind of see these different types of, like, I guess, sources of media kind of getting incorporated into this like very nerdy, journal article here. So
is there sort of more leeway when it's this type of article, like a commentary?
I don't know. My only time I tried to get a commentary published in AJPH, and it was a terrible back and forth with the editor, and he ended up finally sending me an email. He sent me the track changes version of my paper with a note that said there's no edits he could make to my paper that would make it acceptable to publish. And I wrote back, I'm like, I wasn't looking for another co-author. Like, I don't know what, you could have just rejected it. It would. So I don't, short answer is, based on my experience, no, I think they still want, but I think it's just interesting as people sort of, it's like, what is acceptable information?
Yeah.
What is a good indicator of X, Y, or Z? When I don't even know the portion of the population's even on Twitter.
Like, where's the line between anecdote and evidence?
Right. Yeah.
And I don't know, maybe we'll see. I don't think I've ever seen a Twitter quote in a paper before this one. I don't know, maybe we'll see it more. I've actually seen some people in social epidemiology do research on Twitter. So kind of analyzing, so Twitter releases its data and they release kind of like they geotag their tweets.
Mhm.
And so it was I can't pronounce her last name, Nguyen. It's a Vietnamese name that I can't pronounce very well. And she was at UCSF and she did this kind of machine learning analysis of the text contained in tweets to identify racist sentiment and geotagged it and then looked at adverse birth outcomes in regions with more or less racist sentiment on Twitter. I guess kind of thinking that sentiments on Twitter maybe reflect broader racist conditions in those areas. Interesting. I don't know. I think
I find that trash. I would not read that paper.
yeah. I mean, people can bounce their IP addresses. I think it's a stretch.
No.
But
I just think it's sort of like but I completely agree with like, yeah, there's a whole, obviously the School of Information down the street from us. Like that's all they do. I mean, they scrape Twitter, they scrape Google, they analyze Facebook. Like obviously like I guess the question is that, in the same way that when we analyze healthcare records, we know we're not actually talking about health conditions. We know yes, they're correlated for sure, right? You generally don't get there's some things like you don't get an injection of insulin unless there's a very specific set of things going on with you. But people get antidepressants for thousands of reasons that are not like, this specific thing, right? So that's not an appropriate proxy for that. And so I think it's sort of that piece of like, when we don't have a way to anchor it, like healthcare records, I can at least anchor it to, health. Like I can do some validation stuff. Like how do you validate that sort of question? Sort of measurement is.
I don't know. I wouldn't take it as a source of evidence that we can really use very meaningfully in epidemiology or public health. But I guess I will say, I mean, what happened at the Capitol last week? Is that last week or 2 weeks ago? I don't even know. Indicates like what does happen on social media can have very, very real consequences in the offline world because so much of the organizing and communication for those riots at the Capitol happened through social media channels. So there has to be something meaningful. I don't know if it's something that we can collect and use in epidemiologic research.
I guess, sure. I mean, if you're trying to measure collective social action, then Twitter is appropriate because that's what it is, right? It's but if you're trying to say, I mean, it's also, anyway, well, that's an aside.
A whole other conversation.
It's never going to be work I'm going to do. Let's just put it that way. I'm just going to set it over there, look at it and pass it by. So
I think for now, I mean, maybe we'll see it cropping up here and there as sort of like anecdotal framing in papers if people want to talk about what general public sentiment has been, but I don't know in epidemiology as more sound kind of evidence. So I think we're pretty much at time. Actually, we've gone over time if we consider this is normally ends at 12:50 when we're in person. I don't know if we've been ending at 12:50 online. But thank you so much, everybody, for coming. I think this was a really interesting and thought-provoking discussion. I'm glad that we got to read this paper and talk about it. I think it's really relevant for CSEF. Bree, let us know if you do talk to Whitney Robinson about this.
Yeah, no, I'll send her a note and see if and I'll tell her like if she can share with me. I'd like to share it with the group. And so whatever she says in terms of like what the process of review was like. So I'm curious as to how it went. So
I'm curious. And I guess our next CSEF seminar is in 2 weeks. I don't even know what the topic is. It'll be something cool.
No, I think it is actually going to be, it was going to be Yamani, but she is in her new role at social work is not able to do the session. So you're gonna get to hear from me again. So I'm gonna step in, but it's gonna be a professional development Q&A thing. So I will send out information ahead of time, but please, especially for our doc students, our master's students, come. Let's talk about interviewing for jobs. Let's work out all the kinks. Let's get awkward together and share all our fears and anxieties. It'll be great. So look out for that from Abby, but it'll be an interactive professional development thing. All right. Thanks, everybody. Have a great week. Welcome
Thanks,
back.
Lindsay.
Thank you, guys. Thanks, everyone.